Hello, everyone. I'm Dr. Hedvig Risak. I'm a board-certified radiologist with a lifelong commitment to transforming cancer care through medical imaging. In 2021, I had the privilege of chairing the Lancet Oncology Commission on Medical Imaging and Nuclear Medicine. Our goals were clear. We wanted to highlight the indispensable role of imaging in cancer care, but to quantify the tremendous global inequities and estimate the impact of increase in access to imaging. The Commission findings are clear. Without access to medical imaging, there is no early detection, accurate diagnosis, evidence-based treatment or treatment follow-up. In short, there is no modern cancer care. Currently, 3.6 billion people lack adequate access to diagnostic imaging. This results in late-stage diagnosis and preventable death. However, we can change this by scaling up imaging infrastructure and services in undeserved regions. We can avert an estimated 2.5 million cancer deaths annually by 2030. These are not just statistics. They represent lives that we can save. Furthermore, for every dollar invested in scaling imaging access in Africa, we anticipate a $21 return. This creates a powerful engine for health and prosperity. This is not only a health imperative, but also an economic and moral one. Imaging requires more than just machines. It demands trained professionals, quality standards, integrated system, and sustainable financing. It is about prioritizing patients, shifting from fragmented, technology-driven solutions to holistic, system-integrated care. The Commission's work underscores the importance of the World Health Assembly resolution on strengthening medical imaging capacity. I urge you to support this resolution. We must translate evidence into action and ensure that imaging is no longer a luxury for the few, but a right for all. Let us close the diagnostic gap. Let us act boldly, invest wisely, and commit fully to saving lives, strengthening healthcare systems, and bringing equity to cancer care worldwide. Thank you very much.
I'm Dr. Julie Graylow, Chief Medical Officer at the American Society of Clinical Oncology, or ASCO. I'm here to provide ASCO's support for the World Health Assembly resolution on strengthening medical imaging capacity and speak to the critical importance of the role of medical imaging in cancer. Globally, investments in cancer treatment are far outpacing investments in medical imaging. Medical imaging is a critical component in the early detection of cancer through screening, in the accurate diagnosis of cancer, and in staging, where we determine the location and the spread of cancer. Optimal cancer treatments rely on precision medical imaging in guiding treatment recommendations, evaluating response to treatment, and monitoring for recurrence. On behalf of ASCO, I urge member states to promote access to quality, safe, affordable, and cost-effective medical imaging through sustainable investments in imaging equipment and infrastructure, and a commitment to education and training of the health workforce involved in medical imaging. Thank you for your consideration.
Medical imaging plays a vital role in the diagnosis and management of communicable diseases and non-communicable diseases. For cancer patients, more than half of whom will require radiotherapy, medical imaging helps define their tumor's size, location, and guide treatment to protect healthy tissues. Medical imaging is also used to monitor tumor response and progress after treatment. Advances in the field are enabling innovations like adaptive radiotherapy and personalized treatments and improved tumor targeting. As the Lancet Oncology Commission on Medical Imaging and Nuclear Medicine showed, scaling up access to imaging alone can avert about 2.5 million cancer deaths. And this would yield productivity gains of more than $1 trillion between 2020 and 2030. Scaling up imaging, treatment, and care and quality could grow these figures to about 9.6 million lives saved and more than $2.5 trillion gained, all for an investment of $2 billion. As countries around the world expand their radiotherapy capabilities, including through the IAEA's Rays of Hope initiative, investments in imaging technologies and training will be critical to ensure the safe and effective use of these radiotherapy services. Thank you very much.
Hello, I'm Jennifer Dent, the President and CEO of BioVentures for Global Health. I'm honored to express our strong support for the World Health Assembly resolution on strengthening medical imaging capacity. This important resolution, led and championed through the leadership of Cameroon, calls for coordinated efforts to improve access to imaging services. The resolution highlights gaps in imaging infrastructure and workforce numbers and skills in low and middle income countries, and it outlines clear recommendations, including building sustainable imaging systems, investing in training healthcare professionals, and fostering international collaboration. Through BVGH's African Access Initiative, our team works with governments across Africa to expand access to prioritized cancer medicines and technologies. Medical imaging is an essential component of cancer care. It is critical for the detection, the diagnosis, staging, and monitoring of disease. In 2022 alone, there were over 20 million new cancer cases globally, with nearly 760,000 cancer deaths. Africa reported 1.2 million of these cases, and we can all imagine how many cases were never detected and how many patients went without care. Without strengthened imaging capacity, patient outcomes will not improve in low-resource regions. We commend Cameroon for its vision, and we ask all member states to support this resolution. Together, we can close the imaging gap and strengthen healthcare systems for all patients.